Okay, we're also going to talk a little bit right now about radial tunnel, because radial tunnel, I mentioned earlier, does coexist with lateral epicondylitis about 20% of the time. Radial tunnel is in this area right here of the forearm. They'll complain of pain right in this area. Lateral epicondylitis is specific to there. Radial tunnel, you're feeling more here. A lot of times when the patient goes to the doctor, they'll just say, I'm having pain here. They don't always spend the time with the doctor, or they don't always articulate their concerns as well with the doctor as they do with us. So again, we tend to be more patient advocates because your patients tend to feel a little more relaxed with us, and they may share more with you. If you're having pain here, you're going to treat, they're still going to have pain in the lateral epicondyle, so you're treating with like if you're doing iontophoresis and laser, you're treating there too. But if their pain is also being referred to the radial tunnel, you must treat that as well. Myofascial therapy is great with that. You can also do your ultrasound with that, your laser light, some of your high volt, which we didn't get into, and I want to just show you real quick right now. And we'll have Susan come back, and we're going to show you a high volt. You can use interferential current as well. And the thing with interferential, you have 4 electrodes, and it's surrounding the area. And most of the time, you have to have a target spot. There are some machines will allow you to scan, and you're getting that area. I like the high volt, and I tend to use the Jace Tri-Stem, but the high volt is nice because it does help with edema reduction and pain. Oh yes, Sue reminded me, there's a great sleeve, a mesh sleeve, and I'll show you that in a second too. That is really nice for going to work because then they don't have to fool around with the electrodes. As you saw there, I put a large electrode on the medial side of her arm, and I'm going to sandwich this actually. Then I put a smaller electrode on the lateral epicondyle. They do have a big disperser pad, which you could use as well. You could put on your back, your abdomen, your thigh. And if they have discomfort with this, you may have to go to the larger electrode disperser pad. And you can cut this too, as long as you don't cut the wire in there. But remember, it needs to be larger than the area that you're treating. I would plug both of these in, and then I would turn it up according to her tolerance. Normally in the clinic, I would do it for about 20 to 30 minutes. And I would even have them perform exercises while they're doing this electric treatment. If it's the radial tunnel, I'm going to put the electrode, again, I like to sandwich them. I would put the electrode over the radial tunnel and then plug it in on my high volt. And then I would see how they could take it to their intensity and see how well they do. And of course, the electro mesh is really nice, and let me show you that. And right now, I'm going to show you the glove, but it's made out of the same material. And see, the whole glove is now the electrode. So therefore, you would have to use the large one. If you use the electro mesh glove, the sleeve, then you would want to use this large electrode onto the arm.